Hey everyone, welcome to the Pre-Nursing Basics Workshop. My name is Sonia Gordillo and I'm one of the pre-health advisors here in Tykeson Hall, home of the College of Arts and Sciences Advising.
Hi, I'm Amanda Kong. I'm one of the other pre-health advisors, also in Tyson, also here to help you out. She, her pronouns as well.
All right. So today's agenda, we're going to go over the different degree routes to becoming a registered nurse or nurse practitioner. We will talk about which path is the right fit for you, go over the prerequisites and next steps. So before we dive into that, though, we do want to cover acronyms because acronyms are a pretty common thing when we're talking about nurses. So the most common thing that you'll hear is registered nurse. And so in order for you to become a registered nurse, you're either completing an ASN degree, Associates of Science in Nursing. Those are offered at the community college level, or a BSN, Bachelor's of Science in Nursing. So once you complete either one of those degrees, you take the NCLEX exam, and once you pass that, then you're officially a registered nurse. Prior to that, though, there are a couple other acronyms that you might hear, and that is CNA, Certified Nursing Assistant. So this person works under the supervision of a registered nurse. You don't necessarily have to be a CNA before you become a registered nurse, though there are some very few nursing programs that might require CNA certification before you enter that program. So here in Lane County, there's Bushnell University. They have an accelerated nursing program, and part of their prerequisites is a CNA certification. So that is one of few programs that do require that. It takes one term to become a CNA. They're usually offered at local community colleges. If you're interested in that, it's a really great opportunity for you to get some clinical experience and get some exposure to nurses and their field. The other one that you might hear is LPN or LVN. So that is licensed practical nurse or licensed vocational nurse. And so similarly, they work under the supervision of a registered nurse, though they have more training than a CNA. So it typically takes about a year to complete an LPN or LVN program. They do have a little bit of a higher salary, mainly because they have slightly more responsibility. So for example, CNAs can't prescribe medication, but LPNs and LVNs can. Okay, so moving down, MSN and DNP. So this is for folks that are interested in becoming nurse practitioners. So it leads to APRN, so Advanced Practice Registered Nurse. And then there's different types of certifications within that too. So there is NP, CNM, Certified Nurse Midwifery, CRNA, and then Registered Nurse Anesthesiast. There is a little question mark next to MSN. And the reason for that is because not all MSN programs lead to nurse practitioner. Okay, some MSN programs are leadership based. So it's for registered nurses that want more professional development, opportunities for them to gain more skills and leadership within their field. So you got to be careful with that when you're researching nurse practitioner programs. Will it lead to the certification that allows you to become a nurse practitioner, or is it more leadership based? Okay. All right, well, let's dive into the different pathways to become a registered nurse or nurse practitioner. So here on this screen, we have 4 different options. These are the most common options that you'll see in order for you to pursue this level of degree, though these are not the only 4 ways for you to become a registered nurse or nurse practitioners. There's so many different variations of programs out there. So please take the time to research different programs and identify what's going to be the best fit for you. Okay. So as I mentioned before, ASN and BSN, both very similar. ASN programs, Associates of Science in Nursing. So these are only offered at the community college level. So Lane Community College, for example, has an ASN program. And these programs are 2 years for you to complete, and that is not including the prerequisites. So there are still prerequisite courses you need to take, and then you apply for the program once you're admitted. At that point, you do the 2 years of the program. So it could be anywhere for between like 3 to 4 years for you to complete the totality of an ASN degree. Similarly, a BSN program, these are offered at colleges, universities, 4-year institutions. So this is a really great option if you're eventually wanting to become a nurse practitioner. So that's the main difference here. If you're wanting to do ASN and eventually become a nurse practitioner, you do need a bachelor level nursing degree in order to become a nurse practitioner. So that may sway you one way or another here. Okay. But similarly, you would do the prerequisites, apply to the program, get admitted into the program, and then do 2 years of the program. So it's about 2 years of prerequisites, apply, and then 2 years of the program. Okay, you could transfer from U of O into a nursing degree. Okay, so there are some students that say, you know, I don't necessarily want to stay at U of O for the full 4 years. I just want to do the prerequisites here. Great. You can do the prerequisites here, apply to a nursing program, get admitted, and then transfer to that institution. Be careful though, because it might not be a perfect transfer. If you don't get admitted in that first round, you're looking at either staying at U of O for another year or doing a gap year and reapply. Okay. There are some programs that prioritize people at that institution. So let's say Linfield, for example, if you're not a Linfield student, they're going to prioritize their students in that primary application and then open it up to transfer students. So these are conversations you need to be having with admission reps to determine what pathway is going to be the right one for you. Okay, accelerated BSN. So this is what I see most commonly U of O students do. So as we all know, U of O doesn't have a nursing program. That's why we're talking about all of these different options here. So accelerated BSN, these are typically 12-month programs up to 18-month programs. Okay, they're offered at colleges and universities. And in order to be eligible for accelerated BSN programs, you need to already have your first bachelor's degree done. Okay. It doesn't have to be a bachelor's in a STEM major. It could be a bachelor's in anything. Maybe you did your bachelor's in business or sociology, or maybe you did family and human services. That's all great. You need to have at least one bachelor's degree under your belt. That makes you eligible for ABSN programs, and you need to have all of the prerequisites completed before you apply. Okay, so really great option if you're planning to stay at the University of Oregon for your first bachelor's degree, and then you can go off and apply for ABSN and complete this program within about a year. And then lastly, there is direct entry MSN or DNP programs. And this is a great option for folks that know they want to go into nurse practitioner. Okay, so it's direct entry. It allows you to complete nurse practitioner degree directly. So what essentially happens is when you're admitted into these programs, you do the ABSN portion of the curriculum first. You take the NCLEX exam, you become a registered nurse, but instead of pausing to work in the field, you just go straight into that doctoral level program. There's no pausing, you just go straight into it. Okay, so that's the direct entry. Usually they do require some level of healthcare related experience in order to be a competitive applicant for these programs, because they want to make sure they're bringing in people that are very serious about this field. All right. Okay, and then the other thing I wanted to mention here is OCNE. So OCNE is the Oregon Consortium of Nursing Education. So this is a really great option if you're leaning on doing that ASN program, the Associates of Science in Nursing at Community College. So these are really great programs, 2 years to complete it. They're more affordable. It gives you the opportunity to just complete the program and start working in the field. But again, if you're looking for that long-term growth in the field to eventually become a nurse practitioner, you want to get that BSN, then you would do 1 year online through OHSU to get that BSN. So ASN for 2 years, 1 year distance education, and then you could have that bachelor level nursing degree. So really great option here. Right, Amanda.
All right. So for all of these options, they're all going to have prerequisite courses. Um, for some ADN or ASM programs, there might be slightly less requirements, but I would say on the whole, probably not, because you're going to complete a lot of those prerequisites kind of on your way to that associate's degree anyways. So it's likely if you're spending any time here at UO, a lot of this stuff will transfer over. So some of these common requirements are a year of anatomy and physiology, a quarter of statistics, a quarter of nutrition, a quarter of lifespan development psychology, a quarter of microbiology with lab, 2 quarters of writing. And then if you're interested in California schools, there's usually a 1 quarter of speech. It sometimes there might be designations on whether it is like small group or large group communications. So keep an eye out for that kind of stuff. It's typically a California thing because speech is part of California's general ed. We do, I think, 2 quarters of writing, 1 quarter of speech, you know, kind of across the board in California. So that's the reason why you might see it on some California programs. Although, of course, all of these nursing programs are, pretty individualized. You do want to check on each program's individual website to make sure that there's nothing that's been changed in terms of prerequisites or qualifications to apply. Okay, and here are the prerequisites that can vary pretty considerably. So typically when you look at these programs, again, it's going to depend on the structure of the program, but you might see a couple of different things regarding something like chemistry, right? Not everyone will require chemistry with labs. Some people will, some people won't. Some people don't require chemistry at all, but it's a prerequisite to get into the biology classes. So it's a hidden prerequisite in that sense. So again, you want to be paying attention to each individual program. You might even look up whether some of those prerequisite classes have prerequisites there. Sometimes it might make sense to actually do the prerequisite at that community college just because it might be an easier transfer or kind of one-to-one conversion, right? Some upper division biology might be there, might not. Cell biology and genetics are kind of two popular sort of more upper division or more advanced level biology. Again, these programs are typically completed at a community college level, so not all of them are going to need classes at the 300 or 400 level. Some of them might be fine with a 200 level genetics class. OChem is also pretty variable, again, pretty rare, but especially if you're going for some advanced practice nursing, OChem might be a requirement. Ethics, similarly, critical thinking and ethics are sort of, two options. Again, they vary considerably. It's rare, but it could happen. What's more common is to have a requirement of 1 quarter of social science, either cultural anthropology, sociology, sometimes psychology is included in this category. Again, they want to look for well-rounded people, right? They want to look for people who have knowledge of other cultures and attitudes towards healthcare or other kinds of barriers to gain access or treatment. All of those things are going to crop up when you're actually practicing as a nurse, right? And then again, very rare, but they might want some pharmacology courses. Again, probably only likely for those programs that kind of lead to advanced practice nursing. But again, double check, right? So for example, OHSU requires a genetics biology course, but Linfield wants cell biology, right? Sometimes they'll just say a year of general biology, in which case it could be your beginning biology sequence, but you could also have upper division biology that can count as part of that as well. So again, as always, make a list of their programs, take a look at the language that they use to talk about their prerequisites. If you have questions, right, again, come to us, email us the page. We'll take a look at it. We'll meet and we'll talk about what is confusing about those requirements. But a general rule of thumb, follow these common requirements and research the schools that you might be applying to. Nursing varies considerably state by state. So if you're looking for programs in a different state, right, or if you're looking to practice in a different state, look at programs in that state because, again, they're going to be the best match for you to meet that state standards for getting your nursing license. Okay, so as I said, there's going to be a lot of confusing language. Some of this confusing language on these websites has to do with credits, right? So some, or actually would say most of the country is actually on semester system. It's really kind of a West Coast thing to be on the quarter system. That can cause some anxiety over reading these prerequisites and determining how much science you need and whether or not you're getting the right amount, right? So generally, one semester is 2 quarters. 2 semesters is 3 quarters or a year. So when you are dividing your quarters and trying to convert them to semester credit, you're going to take your total number of credits per quarter and divide them by 1.5, right? So your 5 credits of Bio 211 is actually 3.3 semester credits. Now, at this point, you might want to check in with the admissions team at that school, right? Sometimes they will accept 1 quarter for 1 semester. It's really going to depend on each program. And of course, it will also depend on kind of the content of the course, right? I can see situations where the full series or the full sequence may not necessarily be appropriate, right? They might let you just take 1 quarter because it covers all of the relevant material. So again, attend those information sessions, get in contact with the admissions reps. They're going to be the best to advise you on how much science you need. Semester to quarter credit. So if you're trying to figure out what this means in terms of quarter credits for you, and you're looking at the semester credit count on the website, and they're saying you need 3 semester credits of biochemistry. Okay, great. You're going to multiply that number by 1.5 to get the quarter credits, right? So 4.5 quarter credits for biochemistry. Maybe that gets covered by the biochem lecture, and maybe you take a special lab, right? Maybe that gets covered through the combination of Bio 214 and Chem 360, which both have elements of biochemistry in it, right? So again, there are ways to kind of meet these requirements that may not be immediately obvious. It is definitely worth it to talk to some admissions reps and get kind of a temperature check on how they feel about semester to quarter conversions.
Right, so let's do a little bit of a deeper dive on those prerequisites. So as Amanda mentioned, there's kind of like hidden prerequisites for the prerequisites. And the reason for that is because at U of O, in order to take our anatomy and physiology sequence, there's a handful of prerequisites that you need to take. So reminder, anatomy and phys, that's a common requirement for nursing programs. You need a year of it. So at U of O, that's HIFE 321 to 325. You can see that here on the right-hand side of the screen. So it's a total of 25 credits to complete U of O's anatomy and phys sequence. It's an upper division. And in order to take it, the prereq is chemistry 221, 222, and 223, bio 211 and 212, and human physiology 211 and 212. Okay, generally speaking, that takes about 2 years to complete those prerequisites. And then students would take anatomy and physiology in their 3rd year. So you're looking at 3 years of prerequisites before either transferring out of U of O to complete a nursing degree, or if you're committing to that ABSN degree, then you would do your bachelor's degree in something here at U of O. Versus if you were to take anatomy and physiology at a community college, Lane Community College, for example, anatomy and phys is a total of 12 credits. So bio 231, 232, and 233. That is anatomy and physiology combined part 1, anatomy and physiology part 2, and anatomy and physiology part 3 for a total of 12 credits. And the prereq to start A and P there is 1 quarter of biology and 1 quarter of chemistry, typically bio 112 and chemistry 112. Okay. And then once you complete the bio 232, you could take the microbiology concurrently with that last section of anatomy and phys if you'd like to, or you could do 1 course at a time. So you're looking at about a 1.5 years total to complete these science courses at Lane Community College versus 3 years at U of O. Okay. So in addition to that, microbio at U of O has a prerequisite of bio 214. So though you don't need to take 214 for anatomy and physiology, you do need to take it in order to take microbiology, those upper division biology courses here at U of O. Okay. And then psychology 308, that's that developmental psychology course. That's going to complete that lifespan development requirement. The prereq for that is Psych 202, which also counts as a social science core ed. So you could double dip in that aspect there. So we do have a lot of students that end up taking that here at U of O. But if you wanted to take it at Lane, there is a lifespan development course offered at Lane. There's no prerequisite for it. You could just take it, and it's generally offered online as well. So here's a look at what that could look like within a 3-year plan. So what we have highlighted here are the common requirements for nursing. So in that 3rd year, there's that anatomy and physiology sequence, hyphy 321 to 325. So in that first term, you got anatomy part 1 and physiology part 1. Then winter term, you do anatomy part 2, physiology part 2, and then that spring term, it's combined anatomy and physiology part 3. So the prereq for that is that Gen Chem sequence 221, 22, and 23. And here's the other caveat. So in order to start chemistry 221, you need to have up to math 112. That's the co-requisite for chemistry 221. Okay, so there's another hidden requirement. Okay. And then you would do the bio 211 and 212 and human phys 211 and 212. You can see that mapped out in that 2nd year. And remember, there may be some programs that require a term of biology or a term of chemistry with labs. So those are things that we might need to incorporate into your plan as well. But you can see here, there's that statistics requirement with that stats 243. Nutrition at U of O, if you're interested in taking that here, that's human physiology 105. There's that psychology 202 and psych 308 in that 2nd year. And then if you're wanting to take a public speaking course here at U of O, that's English 200 public speaking. Microbiology, bio 330 and 331, that's typically offered fall and spring. It used to be only spring, but now it's offered fall and spring. So that's kind of nice. Okay. So another thing I wanted to mention about these options is that I would say that if you're a lover of science, you love science courses, you're like, yes, give me more. I would say U of O's anatomy and physiology sequence would be a great option for you. It's hard, it's fast-paced, it's intensive, it's 25 credits, yes, but you're part of a human cadaver lab, and that generally attracts students. And because it's fast-paced and intensive, if you're planning to pursue an accelerated nursing program, it's going to set you up for success because you already know what to expect when it comes to fast-paced and intensive science courses. Okay, so that is a really great option. Though with that being said, if you're wanting to take nursing prerequisites at community college, that is fine too. Those nursing prerequisites, many students end up choosing a non-STEM major here at U of O and do the prereqs at Lane Community College. That is enough to prepare yourself for nursing programs, okay? They will accept either. Okay, so it's just up to you in deciding which one is going to set you up for success. I think a really important thing here to note is that most programs require a minimum GPA. Okay, so if you end up choosing to take the prerequisites at U of O and do more science than what you necessarily need for nursing programs, you got to make sure that you're setting yourself up for success. Okay, because you need to meet those minimum GPA requirements. And if taking more science is going to impact your GPA, then let's talk about the plan and make sure that, you know, we can adjust things as needed. Okay, so just some things to think about there.
And I just want to point out that we do have the sample 3-year plan up on the pre-health website under the plan section for nursing, as well as on the pre-health campus if you're there. Okay, so options for getting these prerequisites then, as Sonia said, you can still be a student here at UO, but in a different major and just do the prereqs on top of that, or you could do them as part of your major, whatever floats your boat here. If you do want to do a different major and take the prereqs on top of your classes, you could consider dual enrollment. Dual enrollment is a program that partners between UO and Lane. It is primarily a financial aid program. So this really only makes sense if you have more than 90 credits. If you have more than 90 credits, UO takes care of your financial aid, and whatever classes that you take at Lane can get paid through your UO financial aid check, right? So that means you're able to split full time between these two institutions. You could do 4 credits at UO and then like 8 credits at Lane to make 12 credits and still be full time. Or you could do 8 credits here at UO, 4 credits at Lane, right? This could be an option for you, especially if you're having problems getting into some of these classes, right? Biology and chemistry. Or like I said, if you're completing a different major and you want, a slightly cheaper price tag on these extra classes that you're taking, right? So how do you do dual enrollment? Well, it's pretty easy. You basically fill out the form to get enrolled at LCC. It's pretty basic. You send in your transcripts, you provide some basic information, really nothing that difficult. And then there's a special dual enrollment form. You can always Google University of Oregon dual enrollment, and it should take you there, or look on the registrar's office, or yes, I believe it's on the registrar's office website. And you just got to turn in that form 4 weeks before the first day of fall term, 3 weeks for the rest of the terms, right? So 3 weeks before the first day of winter, spring, and summer. And that's it, right? So pretty easy. If you're interested in this, come in and talk to us about it, just to make sure that's the right path for you and that you kind of have all your paperwork in order.
And I just want to add to that. I think this is a really great option, especially if you're thinking about doing a non-STEM major and doing the prerequisites at a community college, Lane Community College in this example. And it works out pretty nicely because it's 6 courses. It's a bio course, a chem course, and then the anatomy and phys sequence, that's 3, 4, 5, and then microbio, that's 6. So a course, a term between your junior and senior year at Lane Community College. That's not bad. Okay. And the other prerequisites you can take at U of O. You could do that developmental psych here. You can do the stats and the nutrition. Not a problem. We can incorporate that into your plan, but you're looking at 6 courses at Lane between your junior and senior year. That's not bad. Okay.
Yeah. And then again, price tag, right? You're talking about 6 courses at about 4 credits each versus, right, anatomy and phys at the whole whopping 25 credits, right? So again, cost here, right? Okay,
And then
so yeah, go ahead, Sonia.
yeah, I was just going to add one more thing. I have seen some students choose to do U of Bo's anatomy and physiology sequence, which I think is also a really great option. But let's say in the scenario that you're concerned about taking general chemistry here or biology here, they're large lecture halls, you're not quite used to STEM classes, whatever the reason might be, you could take those classes at the community college level, kind of work your way through that, and then take anatomy and physiology here at U of O. So that's another option that we could look into as well.
Mm-hmm. Yes. Plenty of options, which is why it might feel very, very overwhelming, right? There are a lot of different degrees, there are a lot of different paths to that degree. So let's kind of talk about what kind of considerations you should keep in mind when you're figuring out what program is the right one for you, right? So number one, I would say these are conversations that you should have with your family, right? Or whoever is helping you figure out college, especially in terms of money, right? Because one of the biggest things is your timeline. So, how quickly do you want to finish your degree and begin nursing, right? Do you want to complete a bachelor's at UO and like why? Right. There are definitely reasons to do so. Don't get me wrong, but you should be clear on those reasons, right? If it's just because you want this particular experience, that's totally fine. Know that. But if you don't really have a good reason to stay at UO other than like it's UO, again, think about, time to degree, time to work, right? When you want to start working. Think about doing some research first, right? Because admit terms vary by program. Some programs have winter starts, some programs have spring starts, some programs only have fall and spring, right? So there are also those kinds of things to think about. At what point are you going to be done with your degree? Or at what point will you be in your degree, either here at UO or at a different institution? when you're ready to apply, right? Do these prereqs need to be completed before applying? Can you have some, kind of outstanding while you go through the application process? You should look at other things like for nursing programs, it's very common to have kind of minimum standard GPAs, right? So it's definitely worth it to kind of take a look at all of those stats because as we go to the next part, right, we're thinking about competitiveness. Nursing programs tend to have a points-based admission process where you get points for kind of like every piece of this rubric that you do well. So you get more points for having an A versus for having a B, right? You get more points for doing direct patient care experiences versus not, right? And then the people with the most points get in, right? Not all nursing programs are like that, but a fair amount are. Like it's highly likely that you're going to be encountering that kind of admission system. So again, you want to pay attention to things like minimum GPA versus average GPA of those admitted into the program. Do these programs give preference to internal or residential applicants, right? Is there a cumulative GPA and a prerequisite GPA? Are they different? Do they consider both one or the other, right? Those kinds of things. Because again, this is going to be kind of your sticking point, right? For nursing programs, of course, personal statement and these other things count, but there's like way less application materials, right? So like you don't really have a standardized test. You don't really have any other essays for the most part. So it's basically your personal statement and your GPA for, kind of the basis for getting into these programs. So if you are not super good at science, right? Again, I don't know that it makes sense for you to put yourself through 3/4 of chemistry, 3/4 of biology, 3/4 of 25 credits of anatomy and phys. It might make more sense, right, to do them at the community college and just take, A, the lower level, the lower intensity, and B, just the lower amount. Because again, remember that GPA gets averaged out by the number of credits that you have. So at a certain point in your academic career, an A doesn't make the same impact as it does as when you were first starting out, right? So it could be that you kind of messed up in the earlier sequences and you're trying to make it up in the later sequences, but it might be too late, literally like points wise at that point, right? So again, think about how much you love science. Think about how much you love doing science in 10 weeks, right? This is going to be very intense. It's a pretty intense timeline. Again, think about whether it makes sense to go for that community college where it's a much, it's the same amount of time, but it's much less material. So you're working at a much more comfortable pace, right? And then, of course, as we've been saying, think about the cost of an associate's degree versus a bachelor's versus an accelerated bachelor's. So for accelerated bachelor's, because it is going to be a second bachelor's degree, you're not going to have as much access to federal financial aid, right? And I'm speaking specifically about scholarships and grants, right? You will have access to some loan money, but it will be limited. But that's going to be kind of your only option other than school-based scholarships that are available to you, right? So it might make sense for you to do an ASN, to work in a hospital, look to see if that hospital has loan forgiveness programs or other kind of programs to help you out in getting your BSN or your DNP, right? Those are options as well. So I would highly recommend that you talk to some nurses, right? Try to find a nurse who's done like each of these kinds of programs, right? A nurse who's done an ASN, a nurse who's done a BSN, a nurse who's done an ABSN, right? And ask them about their experiences in these programs. We recently did a tour over at Peace Health, and one of the nurses there, she did a direct entry master's program. And she was like, it was super intense, but I would honestly advise everybody to just go the ASN route and then find and work for a hospital where they will give you loan forgiveness and help you pay to get those advanced degrees. She's like, it just makes sense. And then plus you kind of have like a steady job, right? Because you're locked into that hospital for usually 3 to 5 years after, you know where you're going to have a job after, right? So it also kind of gives you that stability and kind of confidence, right? So cost here is huge. And again, like I said, time to degree, right? Depending on when you start the prerequisites, you might be looking at 3 or 4 years extra. You might be looking at 1 year extra, right? So think about that. You could also consider doing the OCNI route while you get your degree here at UO, and then therefore you're only paying for that second bachelor's for that 1 year of OHSU, right? So again, a lot of different ways to kind of finesse the financial part of this. There are ways to pay for it. If you're worried about money, let's talk, let's figure it out. There are national scholarships. This is a very in-demand profession, so there is going to be help. We just got to look for it. Okay, so next steps. Go ahead, Sonia. Or I
So
guess it could be.
next step. So I think the most important part is that you start exploring some nursing programs. So on the Pre-Health Advising campus site, there is a document that you can download that can help you organize the prerequisites as you're exploring them, because there's so many different details you have to look at as you're exploring programs. I mean, there's grade requirements for prerequisites, there's minimum cumulative GPA requirements. Do they require a standardized exam? Do they not? So you have to look at all of those different variables, make sure you actually are interested in that program. So as you're exploring some websites, keep an eye out for any information sessions. Many programs host virtual info sessions or open houses throughout the year. So that's a really great way for you to pop in, gather some information, maybe stay at the end and ask them some specific questions. So I do highly recommend that. Okay. And then in addition to that, of course, start creating a plan, whether it's an academic plan to complete those prerequisites or a plan to transfer, whatever it might be. And you can schedule an appointment with us to talk about all of those variables. If you have any questions about interpreting websites, credit conversions, assessing competitiveness, or maybe you want us to kind of be the middle person talking to an admission rep on a sensitive topic that you don't feel quite comfortable asking them directly, we're happy to do that liaisoning with you. So feel free to connect with us at any point. So here's the phone number to our front desk. You can use also the Microsoft Teams to connect with the front desk as well, or navigate to schedule an appointment. And if you have any questions, feel free to email us at prehealthadvising@uoregon.edu. And we look forward to connecting with you all.
Yes, thank you very much, everybody, for viewing this workshop. We hope that you know a little bit more about where to go from here. And if you don't, again, make an appointment. Let's talk.